If you're about to have a baby, this video is for you. So stay tuned because I'm going to share helpful tips on how to make your postpartum recovery easier. Let's go. Hi girls, my name is Karina. I had a natural birth 3 months ago, and postpartum recovery have been the hardest part of motherhood for me so far. Bleeding, pain, start of breastfeeding, no sleep summed up to a rough time. Unfortunately, this topic remains untold to many women. Everyone talks about sleepless nights with a newborn, but almost no one will tell you how is it going to be for you, what to expect, what is your body going through, how to take care of yourself, which products can help, and so many more questions every girl has about postpartum. I personally learned a lot from YouTube videos, and today I'm going to share my postpartum experience so you can be aware of how is postpartum like, and I'll also give you some tips that hopefully will make your recovery easier. Let's talk about bleeding, pain, and overall feeling after giving birth. So for the first 12 hours after birth, I felt like a big truck ran over me. I felt so weak, it was hard to get up from bed, even harder to turn around. All my face and chest got broken capillaries from pushing. It was somewhat hard to breathe. My stomach felt empty, which is a really weird feeling because, you know, all our organs get pushed around to make space for the baby during pregnancy. So after birth, you actually have some empty space in there. Also, if you don't know yet, you still have a belly after giving birth, and mine looked like a deflated balloon. So overall, the way I looked was very disappointing. However, it got better pretty fast. I had a second-degree tearing and got stitches in a couple of places, and that was the main reason of pain and discomfort. Now I'm sure even if you don't get stitches, it hurts down there too. So in about 16 hours after, my stitches started to hurt really bad, and I had to take a big dose of ibuprofen. There is also this spray they gave me at the hospital, but it didn't work for me. It provides some relief only at the moment. I also heard that padsicles, which are frozen pads, are very helpful, but for some reason I didn't make any during pregnancy, and then after birth I just didn't have time to do so. Although I think they could have been very helpful, so don't skip on them like I did. As you can tell, it had to hurt really bad for me to ask for medication, since I just went through natural birth without an epidural. But really, it's just a different type of pain. And I will link my birth story in the description down below in case you want to check it out. Pain-wise, I would also recommend you to don't even try to wear your pre-pregnancy jeans or tight pants. And it's not because your belly probably won't go away by that time. It's because you don't want anything pushing or even touching your lady parts. So get ready a lot of comfy, loose cotton underwear, sweats and leggings. I had to live in those for the first months. One more thing I will not recommend you to do if it's not necessary is riding or driving a car. Girl, I felt every bump on the road. This pain from stitches is sharp, dull, and burning in the same time, and you really don't want to mess with it for no reason. My pain went away by about 5 weeks postpartum, and I had my doctor's visit at 4 weeks, and she had to remove my stitches for me. For some reason, everything was healed, but the stitches didn't dissolve on their own. She said it happens sometimes. So the procedure wasn't very pleasant. In fact, I was shaking like crazy, and I cannot tell that was very painful. I think I was more like scared that it would hurt because everything was so sensitive down there still. But after she helped me, after she removed them for me, I felt much better. I forgot to mention, right after birth, my legs were also shaking so much I couldn't stop it, and my doctor was just stitching me up. I was so worried if she will be able to do a good job, but she said it didn't bother her. Let's move to bleeding. You have to be mentally prepared that you will bleed for at least a month, and for the first days or even a week, your bleeding will be very heavy. And I have a must-have to share. It's a disposable underwear. Girls, I'm so glad I brought this to the hospital because my hospital didn't provide me with those, although I heard that some of them do. I didn't have to worry about leaking. They provide me with so much comfort, and no pads could ever compete with these. This is how the package looks like. I'm sure that's not the only brand that makes these. Even though they can hold a lot, I would recommend you to change them about every 3 hours or so, in sake of keeping everything in there clean and fresh as much as possible. Even though it would seem like a lot of waste, but you really should change your disposable underwear or pads often. Speaking of cleaning yourself, you will probably get a peri bottle from your hospital, or you can buy it online. I think it's a must-have, especially if you get stitches, because you cannot wipe yourself, you can only pat dry, but it's so important to keep that area clean, so you have to rinse yourself with warm water every time you use the bathroom to avoid any infection. You can also take it with you to the shower, because in the beginning it's really scary and painful to wash yourself down there. Now let's move to breastfeeding, and the first thing I want you to be aware of is that it hurts for the first 2-3 weeks, and even if you do everything right, it still hurts in the beginning. And I wasn't ready for such a pain, because I was told that it will cause some discomfort. However, if I will ensure the right latch and I will not get engorged, then it won't hurt. Girls, it still hurts, especially when my milk came in. I couldn't lift my arms, I couldn't lay on my side or on my stomach. Shower hurts, towel hurts, and even my clothes hurt. I used one of the techniques that won't let you get engorged. I followed a special table to limit my liquids intake, also no hot drinks, no hot showers, and I didn't get engorged. But they were still so full and so sensitive to touch. It was so painful to breastfeed. And there is something I found to be a little helpful, and this is just a gel pack cold, and it can actually be anything cold. It's just something that I used. Are you okay? I'm smiling now. So I'm sharing this for you to be aware of what to expect, because I wasn't ready for it. And I want you to know that after you make it through the first months, breastfeeding will be like a piece of cake. One more thing I would recommend you to stack up on are breast pads. These are from Lancina. I really enjoy using them because I started to leak from the 3rd or 4th day after birth, and surprisingly I'm still leaking. Yes, 3 months after. So they stick to your nursing bra or nightgown, which are actually also nursing mom must-haves, and they will protect you from waking up in a puddle of milk. There is something else that comes with breastfeeding: contractions. It's a normal part of recovery, and it's just your uterus shrinking back to its pre-pregnancy size. And for me, I had felt just like those contractions during my labor in my lower back, and they went away, I think, like in a week after. The bottom line is, as hard and overwhelming it can get taking care of a newborn, on top of that, you will have to take a special care of yourself. And I'm sure that being aware of what postpartum is like will help you to stay strong and make it easier through the first months. And thank you for watching. I hope this video was helpful. If so, give it a thumbs up and subscribe for a new video every Thursday. I want to wish you to have a happy motherhood, and I'll see you next week. Bye.